You are listening to Radio Maria Canada. We now present the Health Hub, hosted by Kathy Biasi.
Welcome to the Health Hub on Radio Maria Canada, exploring cutting-edge health and wellness information and therapies, helping you to take your health to the next level. I am your host, Kathy Biasi, and I'm an holistic nutritionist and a professional cancer coach. Implementation of technological advances into the healthcare space is coming hard and fast, and we need to be informed as to how this will impact us and our experience as we navigate the healthcare system. Today on the Health Hub, I am speaking with Dejan Nenov, who is the founder and chairman of Panaton, Inc., a tech visionary with a passion for turning ideas into commercially successful products. With a background in software and hardware since the age of 15, Dejan brings decades of entrepreneurial and public company experience. Panaton uses AI to make healthcare workflows smoother, break down data barriers, and easily share information. The company's distinctive approach places a premium on flexible workflows, ensuring efficiency takes center stage and meets the varied needs of healthcare professionals and organizations. How can technology improve the effectiveness of healthcare workflows? How can AI influence us as patients? And can technology lighten the cost burden in healthcare? These are big questions that we take aim at in our show together today. So do stay tuned. We will be back in just a few minutes to speak with Dejan.
You are listening to Radio Maria Canada. We now continue with the program, The Health Hub, hosted by Kathy Biasi.
Welcome back to the Health Hub, everybody. No opportunity for calling in as the show has been pre-recorded. Please do follow us on our social sites. We are on Instagram, Twitter, and Facebook, and we are at the Health Hub RMC on those locations. Dejan, welcome to the show. Thank you so much for joining us.
Thank you very much for having me, Kathy.
What you do, what your company does, has most of us on the front end of the healthcare space, so patients, let's say, probably don't have a great appreciation of how the back end of healthcare works. And as we were talking off air, this is sort of what I want to focus on here. Because you know what it reminds me of, Dejan, is actually, you know, when you have a sports team, a baseball team, a hockey team, and players are going up and down because of business side of it. They can only be up for so long because of contracts sort of thing. It's a convoluted end to what we're seeing on the product side. So, I think it's going to be a great enlightening show for people. But how did you get to the space that you're in now?
Well, I professionally have been in software for 30 years, and a great deal of my time has been spent in Silicon Valley, engaging with startups and starting my own startups and working with sort of innovation companies. And in the last sort of 5 to 10 years, healthcare has become a top of mind item for us, and we, semi-randomly started engaging with healthcare projects and addressing challenges of existing organizations as well as startup organizations. And so, as it becomes a rabbit hole that once you dive into it, it is so big. With so much work to be done and opportunities that it kind of sucks you in.
Well, why did the healthcare space draw you in? What was it about healthcare space? A great big hole that you saw a need to fill, or more of an interest space that you wanted to impact?
Both. Obviously, we, you look for challenging projects that have impact. And in healthcare, being arguably a quarter or a third of the economy, there's incredible challenges and a lot of opportunity to improve all aspects of processes, how we handle information, how we ultimately provide healthcare services to patients. And it is always nice to be engaged in work that actually has meaningful impact on people when you can see it directly, because a lot of the work in Silicon Valley sometimes we joke that we invent technology and then we look for a problem to solve with the technology. Healthcare tends to be slightly different. We know exactly what the problems are. There are many problems to be solved, and it's a matter of what can be addressed and in what priority with what resources.
Well, maybe it'd be a good idea for us to get an idea of what you think are, or what you have, what you know are the biggest challenges that you are taking on within the healthcare space.
I mean, the word I always use is complexity, and it sounds kind of silly, but if you look at what it takes to actually treat a patient, even with something very simple, even ordering a medical test for a patient, that can become surprisingly complicated. And I'll walk you through an example. Right now, there's some very interesting new medical tests out there that have come online in the last few years that are genetics based. From companies like Exact Sciences with Cologuard and the Grail cancer tests. And these are tests that are called liquid biopsies. Basically, patients give blood samples, and then genetic sequencing is done on those blood samples, but looking for pieces of tumors that we know what the genetics looks like. So basically, if your blood sample yields that there's microscopic particles of tumor genetics that are related to a lung cancer tumor, then obviously should probably follow up with your doctor and see what's going on. So if you want to order a simple test like this, you're not feeling well or you want to get screened, go to your physicians and you say, is it advisable for me to take this test, or the physician suggests it. The next step is actually not to go give blood, but you may need to get prior authorization from your insurance company, or you may decide to pay for a test yourself. So there needs to be an exchange of information between your primary care provider or your physician, yourself, and the insurance company. The insurance company may do pre-authorization, or they may say no, this is not covered. So you may have to then go back and say, but I really need this test because I have the symptoms, or your physician has to do that. In order to get approval, they may have to submit some medical necessity documentation. By the time that is all taken care of, you now have to schedule a time to go give blood, or phlebotomist to come to your home and draw blood for you. Then that sample needs to be shipped to a laboratory. The laboratory has to process it. And if they find something really wrong, they actually cannot just email you results saying you're really sick. They probably will talk to your physician and maybe set up a counseling session. So something very simple, I want to give blood and get tested, suddenly becomes a complex process or a workflow that involves many different organizations and healthcare providers and individuals just to deliver that simple test. Now, imagine what it takes to actually organize a major surgery.
Mm-hmm.
And so the work that we do in information systems always looks for how do we simplify, make it more efficient, make sure information is correct and not lost, because obviously you don't want to get the wrong sample for the wrong patient tested at the lab and deliver the wrong result. That obviously is very, very bad. And so this sort of a massive amount of simple steps, when combined, become highly complex and challenging to manage.
Well, okay, can this be applied outside from country to country? Is this without borders, or are you working specifically within a country? I'm going to assume the United States at this point, or is your workflow, will it be pervasive?
The fundamental technologies are pervasive. The US healthcare system has its quirks and it's unique in the world. And so some of the complexities that we deal with here are only present in the US. But conceptually, in terms of providing healthcare to patients, especially when we get at the sort of population health level, screening and population health, these are things that exist everywhere.
Dan, who hires you? Who hires your company?
Uh, there are three types of organizations that we mostly work with. There are technology startups that want to bring some new technology to market that we help with sort of more sophisticated software engineering services. Basically, developers for hire, if you would, but with somewhat specific experience. Healthcare organizations, healthcare systems. I'll name a few which are not necessarily our clients, but just to give you a sense, St. Luke's System, Kaiser, Wellstar on the East Coast, those type of healthcare organizations that may run, anywhere from a couple to a few dozen hospitals and take care of a few 100,000 to a few, tens of millions of patients. And then small healthcare providers like individual laboratories and clinics that want to integrate the information systems with the neighboring big healthcare system and their insurance company. And then finally, payers, insurance companies that need to gather, process efficiently and correctly a lot of healthcare information in order to, again, provide the financial support for healthcare services that is provided by our physicians.
Is there a question of privacy that comes into this exchange of information that's starting to happen?
Oh, absolutely. Well, privacy has been a front and center, issue across the board. We approach privacy from very simple, basic, sort of axiomatic assumptions. And the assumption is that the patient owns the information. And so as long as the patient is capable of knowing who, why, and when has access to the information, then we feel comfortable that we're compliant both with the privacy rules of various federal and state regulations, the HIPAA, the specifics in California, for example, but also, just from a basic ethical and moral principles, we are doing the right thing. Essentially, if I know that this part of my health information has been provided to this hospital because I expect to have a surgery in 3 days, that's okay. But if my healthcare information is provided to a telemarketing company that wants to sell me an at-home nutrition test kit without my permission, then obviously that is probably not okay without disclosure. And so the good thing about healthcare information privacy is that, if you just apply common sense, it becomes pretty obvious. At the same time, there's some very interesting things that there's competing regulations that you have to be aware of. And I'll give you an example. One of the fundamental principles of privacy is called the right to be forgotten. In other words, for me to be able to reach out to a company and ask two things. Tell me what information you're holding for me. And then I may decide I want you to erase all of my information that you have, which is fundamental sort of privacy concept. Very much sort of regulated in Europe. Mostly in the United States, it's the California privacy rules that apply similar principles. Some of the other states are more relaxed in this area. But If I'm to comply with that regulation, a patient comes and says, I want you to erase all my data. Now I have a problem if my system holds financial information. Let me explain. A physician has built the insurance company for a service they provided to me for an exam. They provided the insurance company with my health information in order to demonstrate that the service was needed and they can get remunerated. If I ask them to erase all my information, that audit trail, financial audit trail, would be erased, which is not allowed. Depending on, again, the domicile that you're in, financial information may have to be retained between 3 and 10 years. So now you have a conflict between two regulations. The privacy HIPAA side of, and again, privacy rules of, hey, the patient needs to be able to ask a company to erase their data. On the other hand, it has the financial auditing rules that says, and insurance company rules that says, you have to retain this information to prove that this was not a fraudulent payment made and insurance documentation provided. And so reconciling those is the most challenging part usually when we talk about privacy. Hello, Kathy, I've lost you.
Oh, sorry about that. I'm trying to put this into the perspective of the patient, like patient first. So does the patient see the impact of what you're doing? Is there any direct patient application of what you're doing, or is this all through the minutia of the system that it's coming at the patient?
Oh, certainly. I think probably the most impactful thing that we've all seen so recently has been the ability to go online and see all of your patient information and interact with your providers online directly, rather than have to, call your doctor on the phone and jump in the car and drive to urgent care. But the patient portals, where I see all of my, medical history for the last few years of when I saw a doctor, what was prescribed to me, what tests were done, what was my treatment plan. I think those are incredibly valuable, just for me personally and for my family as well. So this providing direct communication and ease of communication to patients, I think, is an end result of, probably half of what we do sort of in the back room. Certainly the ability to authorize healthcare services quickly and not have to wait for months to be able to schedule a procedure is very valuable. And then, long-term impact, the more efficient the system, the less it costs theoretically. So we all everything we do is always with an eye on efficiency and minimizing waste.
That was going to be my next question. Is it a cross between efficiency with respect to time of the doctor? When it comes to that, is that reducing the costs of the entire medical system? I mean, this is a big problem, right? The medical system, both in the United States and Canada, it is stressed, to say the least. So is what you're doing either freeing up time, which is cost beneficial, or actually actually being more cost beneficial bottom line? Is it a combination of both?
Absolutely. Time is money. And surprisingly, every little thing matters when it's repeated hundreds or thousands of times in a week or a month. And I'll give you a very simple example. Again, I'm kind of very deep in medical testing and laboratory systems right now. So this kind of examples pop into my head naturally. But if you go to your hospital or doctor and they order a medical test for you, there's two ways that the medical test can be performed. Either by the hospital lab, what we call a captive lab. these are routine things. They draw blood and goes down to the basement, or the whatever floor the lab is on, and gets processed, and then you get a result. But certain tests have to be sent out to an independent lab because the hospital lab just doesn't do that test. Believe it or not, a very large percentage of that process of sending a test out to an independent lab is still done through fax. Literally, a nurse will print out a piece of paper out of their electronic medical record or healthcare record system, whatever software the practice is using or the hospital is using. They will print that out and sometimes even walk it to a fax machine and fax it, or send it through fax electronically. Then the laboratory will receive it and somebody has to enter it. Now that little thing, let's say, takes 3 to 5 minutes for the nurse to take care of that, to send the test out, and takes 3 to 5 minutes on the other side for an individual to retype the information from the fax into the lab information management system, which is known as a LIMS. Now you say, okay, well, so a few minutes here, a few minutes there. About 30% of all medical tests in the United States are done by independent labs. And we do about 1 billion tests with a B a month. So when you start adding up the minutes, now you're looking at, I can't do the math in my head very quickly, but
it's a
you're
lot of
looking
minutes.
at hundreds to thousands of people whose only job really would be to send faxes, print out paper, and type information. And so what we do in what we call system integration, or integrating systems together, is to make that process, to remove those few minutes from that one step of one process, which is if a doctor orders a lab and they push a button, the software, the hospital can say, which lab does this has to go to? I know how to package it electronically. There's a healthcare information exchange format called HL7, which is quite dominant. And so, we'll package it in that way. Do we have a connection to this lab? Hopefully we do. And we send the electronic record. It's already done automatically into the LIMS system of the lab. And so when your sample arrives at the lab, everything is ready for it to be processed. And that process starts with something called the sessioning, which the lab verifies that the sample is actually from the patient that it's supposed to be from. And so again, it's the little things that can have very serious impact. And I can give you dozens, if not hundreds, of examples of such little things.
Will that benefit us as a patient in the lines that we're waiting in to get these tests done?
Oh, absolutely. I mean, obviously, if you can increase the throughput of your lab by 10%, that means, in a significant number of cases, you get your results today, not tomorrow, which I think timeliness is a very big deal, especially when somebody's sick and waiting to really be able to know what's going on and get a treatment plan.
With respect to labs and tests and results, one of the more stressful things of being a patient in the healthcare system is that time lag between testing and the results. Do you foresee, as more and more system integration is coming into play, that this time lag will be diminished?
Certainly, again, applying technology and applying information system should and does decrease the time it takes for people to get care. There are, of course, there's a lot of research and a lot of work being done in medical diagnostics, and I'm involved in some of that as well, which makes it possible to improve the fundamental approaches of how we go about medical testing. Again, an example I think would be easier to understand, but if I'm not feeling well today, right, I have abdominal pain. I call my doctor and say, I don't feel well. I don't feel bad enough to have to go to the emergency room, but I don't feel very well. I would like to be seen. And they say, great, come tomorrow or come in 2 days. Now, 2 days from now, I wake up in the morning to go to the doctor. I no longer have abdominal pain. I'm feeling kind of okay. So, I go to the doctor, they draw blood, urine, and they say, well, you look kind of okay. Yeah, we don't see a big problem. Of course, I go home and Murphy's Law the next morning, I'm not feeling well again. And so this timing of being able to get care sometimes is obviously very stressful for the patient, but also makes it difficult for your healthcare provider to really diagnose your problem.
Mm-hmm.
There's medical technologies that are coming online that allow at-home collection of samples, so that you can take a small blood sample, a capillary blood sample, or a urine sample at home at the moment that you're not feeling well and send it in. That, however, is not typically how healthcare has been offered. It really has been, you have to go see your physicians and they order a test depending on what they determine your likely problem is, this triaging of conditions, if you will.
Interesting.
And it continues to be the case that, no medical test is 100% accurate. No automatic thing is, going to diagnose. It really requires a physician who really evaluates you and understand what's going on, be able to provide a diagnosis, a treatment plan.
So, and what we're trying to do, sorry, go, you finish your thought. Sorry about that.
But technology is stepping in to make those processes more efficient and better for the patient.
Okay. Let's take a quick break. I'll save my question for when we come back. Everybody, we will be back in just a couple of minutes to continue this conversation.
You are listening to The Health Hub here on Radio Maria Canada, a Catholic voice wherever you are. To contact us and be a part of the show, email thh@radiomaria.ca. We now continue with the program. Here once again is your host, Kathy Biasi.
Welcome back to the Health Hub, everybody. Dejan, one of the questions that popped into my mind as the break approached was, with the advent of more an online medical system, do you think the bureaucracy of the medical system will be tackled more in the patient's favor, if that makes sense? Getting tests, getting the lab work, getting all the T's crossed and the I's dotted. Do you think a more integrative system will present a more lenient and easy flowing system for the patient to navigate?
That's a very interesting question, Kathy, and very complex one. I come from a background of a Silicon Valley software startup person, and so the tendency there is to move through any barriers and bring in new technology to market and conquer the world kind of thing. And of course, bureaucracy is something that naturally comes to us as something that needs to be overcome and made better. What I have found, however, in healthcare is that bureaucracy, the way we perceive it, is often there to protect the patient. And there are issues in healthcare, and there's regulatory environments in healthcare which serve a specific purpose. And I have learned to take a very cautious approach about judging what is really something that needs to be removed and eliminated to make things better, quote unquote better, versus what is there to really protect the patient. And there's ethical considerations in providing healthcare that, again, don't come naturally to most people because we don't run into them. And again, I'll give you a very, very simple example. I'm involved in some medical diagnostic startups in which one of the most challenging things is conducting clinical trials. And in a clinical trial, one of the most costly and challenging things is collecting samples and recruiting patients. And what was a surprise to me when I first, was told is that it is actually illegal to pay somebody and buy blood from them or buy a urine sample, because that would be trading in body parts. So under most regulatory environments in the world, buying any sort of medical material is illegal. It's trading in body parts, and it has to be very highly regulated and controlled. And that makes perfect sense. We don't want people selling their kidneys for transplants, on an open market. That obviously nobody would want that. So how do you go about, compensating a patient for providing a sample to a clinical trial? And without clinical trials, we really would not have new diagnostics or new medications. At the same time, not create a society in which body parts are traded, right? So the way you work around that is basically you compensate the patient for their time to drive, to give the sample, for their time to fill out and provide their medical history, but you cannot, trade in body parts. And so we run into those, when we talk about bureaucracy, we run into a lot of things which have been established over the last 50, 60 years to protect patients. Now, they do stagnate because paper-based processes that were set up in 1970 clearly do not work well today, given all the technology information systems capability we have. But conceptually, the problems that they're addressing have to be addressed in many cases. They cannot just be shoved over the rug.
And this is one of the areas that, we don't understand as a patient what has to be fulfilled on the back end. But, as more and more testing and availability of these integrative tests and tests that are not as common to the medical profession are coming on board, people want access to them. And it's a fine line, I guess. And, maybe where this is also taking us is in a conversation, maybe not directly, but when I think of, accessibility and understanding and having me in control, now I see the AI picture coming into play. And so you have been working on integration of systems for years. And obviously AI isn't new to you or new on the scene to you, but how do we as patients at the front end of the system understand the impact of AI and flow of medical information and technology and process? How do we integrate that into our lives?
Well, AI as a topic and AI as technologies is a very broad field. Now, today, most people, when we talk about and think about AI, we're thinking of chatbot search or generative language models. A lot of medical AI is actually related to machine learning, which is the ability to recognize, in many cases, the ability to recognize patterns. Again, I'll give an example. An AI system that examines X-rays is trained to recognize tumors from images of, let's say, chest X-rays or MRIs or other imaging. That is very different technology from the chatbot, where you ask a question and it will provide information based on billions of pages of information it has been trained on. When we approach AI technologies in healthcare, we kind of try to be specific about what we're trying to accomplish. I think from a patient point of view, being able to get concise information on what your options are so you can manage your own health is incredibly valuable. And I use this all the time. Even though I'm involved in healthcare, I'm not a healthcare professional. I'm not a medical, I'm not medically trained. So a lot of my knowledge is partial and secondhand and incomplete. And so the ability for me to go and say, hey, I have these symptoms, I have these lab results, and what could possibly be wrong with me, and get hopefully correct information from an online AI system is useful. But it also needs to be taken with a grain of salt and always verified. I recently posted actually an example on LinkedIn of hallucination, how the AI system returned an answer to a query of mine, which looked absolutely perfect. It had dates and factual information, names of companies, And I looked at it and said, this is completely wrong. I know this for a fact because I was involved in these events personally, and I know this is wrong. So we need to be very careful with AI and always verify primary sources, at least today. People are
In
working
its
frantically.
infancy stage.
Yes, people are working frantically on making sure that what is produced, is really less hallucination and more fact. But we're not there yet.
Well, where do
At
you
the
see the
same,
future? Because, for me, and I don't know anything about what you do or AI, but for me, my hope is that AI can lead to novel treatment plans or discoveries. Is that a
yes.
possibility, or is this simply an in and out, information fed in and information fed
Oh
out?
no, it's absolutely happening today. Uh, it is happening today, even at the again regulatory level. The FDA in the United States is working on new rules which regulate software as a medical device, and they're specifically putting out for commentary rules about how AI systems will be trained to provide uh, either medical diagnostic information or medical advice information so that that can be managed and to address exactly these risks and problems that I mentioned. So it is absolutely happening. Again, I'll give you an example. I'm involved with a full disclosure. I'm involved with a startup, so I have a financial interest in it. So I would like to disclose that before I talk about it. But we're working on a AI machine learning technology that uses human urine to determine if a disease is present or not. And this is a very classic way of training machine learning algorithm that says, give me urine samples from 1,000 patients that have inflammatory bowel disease, and then give me 1,000 patients that do not have it as a control group. And now I can train a machine learning model from data about the contents of that urine to distinguish between this is positive and this is negative sample when you start giving me blind samples. And that's a very much technology that exists today and is actively pursued. A lot of it is, again, in these areas of genetic sequencing of genetic material that's in our blood, or what's called a liquid biopsy, but also in many other sort of fields of metabolimics and omics, as it's at general. So yes, the technology is very much viable, and it's here already in some cases, and it's definitely coming in many others.
Well, the area that I'm interested in when we're having this conversation, there are a lot of wonderful tests that can, and if the urine test is one of them, and we can be less intrusive as a testing world, that's wonderful. If we can get more information from less invasive procedures, that's a win for us for sure. But we get these test results, then what do we do with them? It's
Exactly.
it's great to know, but is AI also going to be working to, let's back up a bit here. With COVID, we saw this great integration of scientific minds from all around the world working together to try and beat this, right? Is that where AI can lead us as well, so that now the scientist who has discovered something is not waiting 12 years before he sees it implemented? Do you see that gap being lessened?
Uh, Decisions made in crisis situations tend to be made more quickly. Uh, you know, there's a saying, I think, that surgeons use that say that the greatest advances in surgery made during wartime, because you don't have time to ponder. You just have to try to save the patient, and you do what you need to do, whether or not you have had time to consider all the risks. I think the COVID situation was similar. We just had a crisis in our hands that we were not quite sure how to deal with and how serious it was. And so every avenue was open as long as results could be demonstrated. I
What's
tend to
wrong? What's wrong
personally,
with that in
I
medicine?
nothing is wrong with that, but you also be aware that there were many COVID tests in the market that were useless
Mm-hmm.
because they were not controlled. They were essentially, with such low selectivity and sensitivity or accuracy that essentially it was a coin toss. By and of course there was medical advice offered of how to treat or prevent COVID, which was also useless. I mean,
Mm-hmm.
people walking around with sprayers, spraying surfaces, and wearing gloves it turned out to be meaningless because COVID was transmitted through um,
Air particles.
aerosols, particles of respiratory transmission. And so, but we tried everything we could. So in a crisis environment, when everybody is working on something, things happen faster. Again, both from psychological reasons and also many people working on the same thing. In real life, when you're trying to create a treatment for a disease or a condition or a medical test, they're typically for one for one thing at a time, for one disease at a time, one condition at a time, one medication at a time, one test at a time. And they address a condition that impacts a much smaller percentage of the population. Therefore, the urgency is a lot lower. And you're competing for time and attention with another 1,000 researchers or companies that are bringing their own treatments for their own diseases. And so I think it's not necessarily a function of our ability, but just the function of allocating resources. Again, a federal agency that has to look at 1,000 medical tests a year and determine which one are viable and valuable can only do so much, versus when that agency has a priority of you need to deal with COVID right now and everything else is secondhand. Obviously things are going to happen faster. To answer your question though, yes, technology and artificial intelligence specifically does have an impact because it allows us to evaluate things faster, if not necessarily better, but to give us a baseline evaluation of information more efficiently. Again, I'll make the caveat: always check the primary sources.
Mm-hmm. But the doctors can use this as well. How are doctors embracing AI? Because they too can use it as a method to go through the minutia.
Absolutely.
Possibly.
The current state of affairs is providing to physicians what we call a clinical decision support system that basically says, hey, based on the healthcare information and history of this patient and the symptoms that they're presenting within the medical test that you've just did, consider these potential conditions. By the way, there's new medical research. Here's a list of articles that you may not be aware of. Oh, maybe these are, you may want to consider these other medical tests that can be performed, that have been performed in similar cases. And so giving the doctor a quick and easy way to look at the menu of information that may be relevant and have them make a clinical decision based on that enhanced set of information is where currently I think AI and AI technologies are most useful. What we need to be very careful about is delegating decisions for the healthcare of an individual to a computer system completely. Again, I do not believe today that the state of technology is making me 100% comfortable that I just want to ask a AI bot to diagnose me and prescribe treatment.
That's fair enough, but that also is a very good way to end off, because at the beginning we were talking about how this impacts the patient. And one of the things was time efficiency. If there is one complaint that I have heard over and over in the medical space, I've done shows on it with people, is the burnout of the medical system and the professionals in it. And the inability to really, many doctors have said this too. They don't have time, to do research, expound on nutrition, do research on nutrition when they're treating, say, cancer, because they have to look down, one lens. And to me, one of the things that I'm most hopeful in AI is that the freeing up of time in one area will give doctors a pointed direction on articles and literature and science to read, and they don't have to maybe go look and search for it as much. It's there at their fingertips. And that to me is an exciting space in the healthcare industry. Do you feel that doctors are embracing this, or is this, is there a little bit of apprehension?
No, I think doctors are embracing it, and they consume the research. Like everybody else, doctors, consume the resources that are given to do their work and provide healthcare to their patients. So in the work that I do, involved in software and systems, the ability for, your software to basically pop a little window and say, hey, I have additional information on this. Do you want to see it? And the doctor can say yes. And then they say, hey, here's this, there's basically this research on nutrition that is relevant to what you're doing with this patient today. Would you like to see more about it? I think it's actively being delivered today. But there's certainly other AI-based technology that is equally valuable and important. And this as simple as removing the need for a doctor to be sitting at a keyboard, or even a nurse, and obviously nurses in many cases do the majority of this work, and entering information. If you go to your physician and you count the clicks of the mouse that will be done in the process of seeing you for something as simple as a flu, you will be amazed. I've done this. I had the flu a few months ago. My flu shot didn't work apparently this year, or I traveled too much. And I went to be seen, and I literally, I think there were over 100 clicks of the mouse between standing at the front desk to be checked in, the nurse practitioner, taking my entering my base information, and taking my weight and blood pressure and temperature and fever and all of that, and then the physician actually seeing me, and everybody sitting at their computer clicking, entering information. The state of technology today is that in reality we can accomplish 90% of that by simple voice, by just narrating and dictating to a system to accomplish all of those tasks. And this is a low-hanging fruit that's been around for many years, but we haven't fully taken advantage of it. So I believe,
go ahead.
I believe there's a lot of technology out there that has existed for a while, is quite mature, that we should be applying before, even though we get excited, about sort of the brass ring of an AI system that can, functionally replace humans.
Streamlining the everyday life of a doctor would
absolutely.
And it's unfortunately we're at the end of the show, but there's so much. I'm amazed at how many questions come into my mind talking to you. But it almost seems like within the medical educational space, when doctors are in training, they need to have a whole course outlined about how to use AI technology within their practice. I mean, doctors that have been practicing for years and now this is being thrust upon them. It must be challenging to try and stop. I worked in a dentist office and we had paper files all over the office. And I know that dentist waited years and years before he finally bit the bullet and just put the files on the computer. So it's all about time. And I think, the systems integration it's a fascinating topic for me. And I think, everybody, it should be for you too, because it is so impactful on our experience within the healthcare system. Dan, thank you so much. It was a really interesting conversation. I'm really glad you had time to come on our show.
Thank you very much for having me, Kathy. I appreciate it.
Now, before, we were talking so much, I didn't even give you a space for introduction of your company and how we can reach you. So tell everybody the name of your company, how people can contact you if they're interested in more information.
Well, with your permission, I'll mention 3 companies. For information systems development and software development and integration in healthcare, please look up a company called Panaton, Panaton. For software, specifically tailored for AI-powered workflows in healthcare, with a specific expertise in independent labs and labs in general. Please look at the company called One Health. That's the digit 1 and the word health.io. And then if you're interested in some cutting-edge AI-powered medical diagnostics technology, please take a look at a company called Luventix. That's Luventix. Luventix.
Thank you so much for joining us. It's been a very, very interesting show.
Thank you, Kathy. Take care.
Everybody, we'll talk to you next week on The Health Hub.
You have been listening to The Health Hub, hosted by Kathy Biasi, here on Radio Maria Canada.